Thank you, and good afternoon. We continue to see a very rapid pace of reopening in San Diego County with businesses and leisure activities around our county continuing to reopen. And we see these reopenings at the same time. We watch very significant spikes in cases in other states and jurisdictions that started their reopening process ahead of us. This is hopefully a strong reminder of the need to be vigilant, the need to take the actions necessary to do everything we can to avoid the surge that we are seeing not only in other states but in other counties here within California. We certainly hope that our efforts around testing and tracing in particular allow us to more rapidly identify positive cases and isolate them and contact trace their close contacts to determine if they might be positive as well. But the testing and tracing component only serves a partial purpose in slowing the spread. The other way that we work to slow the spread are the actions that we've asked San Diegans to take. We, as a county, do have a mandatory face covering with anytime you're within 6 feet of a non-household member, and there is growing evidence that suggests that these are effective in slowing the rates of transmission. And we urge the public to please, as best you can, adhere to those orders, along with the things like hand washing, physical distancing, and temperature checks. It is the hope that those four actions, combined with the testing, tracing, and treatment, put us in a position where we can manage and contain the spread of coronavirus in a way that protects the integrity of our healthcare system, protects our lives, but also protects our ability to continue with an economic reopening. As we've talked about multiple times, we have 13 triggers that we measure on a daily basis that guide us in terms of the ability to continue to reopen and also guide us at what point we need to take some action to address an increase in cases. There are 3 of these triggers in particular that are an immediate red flag, if triggered by themselves, would cause us to take action. And I just want to spend a moment talking about one of these triggers, which is community outbreaks. Community outbreaks are an outbreak in a setting that is outside of a congregate care setting, outside of a hospital, a nursing home, a skilled nursing center. Community outbreaks are locations that are truly in the community. On Wednesday, we had 3 community outbreaks, new community outbreaks in the preceding 7 days. Today, we have 2 more outbreaks. That brings us to a total of 5 new outbreaks in the preceding 7 days. These outbreaks have been at a restaurant, in an office building. We have previously seen them in churches, individuals' homes, parties, unauthorized weddings. These are the types of scenarios and settings in which we are seeing outbreaks. And again, the triggering would be 7 new community outbreak settings in a 7-day period. And so we will continue to monitor these as we go forward. But it is a reminder that each of these occurred in settings where individuals congregate together, generally indoors. And so we continue to urge caution when non-household members are congregating together indoors, that the danger of coronavirus remains and its ability to spread continues to be present. And so we ask and hope that we have continued widespread adherence, which would hopefully continue keeping San Diego in a positive position and positive place to continue during our reopening. Another part of our efforts surrounding the reopening are certainly efforts surrounding testing. And we want to see an increase in our testing, which we are working tirelessly through our T3 strategy, test, trace, and treat. I want to commend the County Health and Human Services team and our T3 strategy led by our Director of Health and Human Services, Nick Machione, who have spearheaded the strategy to really try and ramp and increase our daily testing capacity, which gives us a better surveillance into the community and a better ability to rapidly identify positives. And then the tracing component is vitally important, where we identify the close contacts of those individuals and we can test them, which we believe helps us stop the spread. But one portion of this that's important is that we do have continued testing in terms of people signing up to get tested. We do have a lot of testing capacity, and we want to match that and mirror that with individuals seeking to get tested. And so today we're announcing a new website, an interactive website that we think will make it much easier for San Diego County residents to get a free test. And again, the testings that are available through this website are free of charge. They're available to anyone in San Diego County who has a desire to get tested, and we have testing sites located throughout San Diego County. And so I'm going to briefly walk you through this new sign-up tool and point you where to go. So if you go to 211sandiego.org, I just did it on my phone before we came out. We tested it yesterday. If you go to 211sandiego.org, you will see this page that will show up on their homepage. If you click on free COVID testing available, the really big one right there, really hard to miss, then it will take you to the next page. It will take you to this site right here, and this site gives you a couple options to look for testing locations and testing schedules. This is where you can find the testing location that is closest to you. So if you click on testing locations, it will take you to this, and you can either enter your address, or if you allow location services, it will pull up all of the testing locations and identify the one closest to you. You look at the one that you want so go to the next one here. This is a sample. If you lived in the 91950 area, this would show you a number of the ones that are close to you. And then when you see this, you can identify the one. You can see the times that they're available based on the days they're available. If that is a date and time and location that's convenient for you, then you would actually click on that location, which would allow you the opportunity to say schedule testing. That would then pull up this, where you would begin to enter your information. Again, testing is available to everyone who is over the age of 12. If you are under the age of 12, you will be directed to Rady Children's Hospital to make contact with them, and they are handling our pediatric testing. But we'll get a little bit of information for you. We will confirm your information and schedule you for a test. These are for the ones we do through the county. Some locations are run by the state, and if you click on a state testing site, then this is what it will look like when you come from there. You will very similarly follow the steps, enter your information, and you will be confirmed for a test. So again, we are encouraging folks to go to 211sandiego.org, utilize the features that are there to arrange to get a test. And again, these tests are available to anyone in San Diego County. There is no cost, there is no charge, and we encourage folks to go get tested. With that, let's jump into our daily reports and charts. Speaking of testing today, a pretty significant number. Again, as we have seen, this is, we think, represents batching of several days of tests, which takes us to a single highest day total. Most of our single highest day totals have been days where we thought it included batching, but again, we are progressing forward, and you can see that 7-day average at 4,662. Again, this is the number we really want to get over 5,000, but we continue to move forward. Contact tracers continue to advance, 440 contact tracers on board. You can see we're well in excess of 200,000 tests, over 11,000 investigations performed, and then our treatment rooms available for folks who can't isolate, you see there. Going to the next chart, you will see today we are reporting 132, I believe, 132. Out of the total of over 6,000 for a 2% percentage of positive. And again, what's important here is that 14-day rolling average you see there holding very steady and flat across there. Going to the next chart, you will see very minor changes holding relatively stable from yesterday. Down a little bit on ICU, down just a handful on 9 ICU. Again, these are COVID-related hospitalizations in our area's hospital system. We go to the next chart and we can see this 352 COVID, along with the non-COVID for a total of 4,032. Again, with that 80% cutoff or trigger right there at 4,863. Next, we'll look at the ICU utilization for today. Again, you see the COVID-related ICUs down just a little bit, non-COVID ICUs up just a little bit, which brings us to a total of 69% of our ICU beds are presently occupied. Again, our triggering number is 80%. So we are up a little bit, down a little bit over the preceding weeks, but that is where we are today. With that, that concludes my report. I'll now turn it over to Dr. Wilma Wooten for a Public Health Officer's report.